Hello everyone, I'm Dr. Taskin from Homeopathy Musings, and today we have with us Dr. Charuvahan sir. The first question that I want to ask is, what is the importance of learning both the classical and the contemporary concepts of homeopathy, and how we can together combine and integrate and apply both the concepts in our clinical practice? If you could throw some light on that, sir.
Yeah, very good question, Dr. Tuskin. When it comes to the traditional method and the contemporary method, so as a homeopath, it is very essential for us to learn both this method in depth. Learning the traditional method, say like the basic principles of Hahnemannian homeopathy with the basic organon, materia medica and repertory knowledge, you can always be feel grounded in your practice. So this is one of the most essential quality or the fundamental thing you should possess in your homeopathic practice. So with this grounded, strong, deep fundamental knowledge, when you learn the contemporary methods and concepts, you can take your practice into more advanced and more deeper level than staying only with the traditional method, because the all these contemporary methods are nothing but an extension of the traditional method. So everything is not a new or separate concept. Everything has been extended from the basic knowledge of organon, materia medica, and repertoire. So the concepts, the new concepts, the new ideas is not new in homeopathy. It has been always happening throughout the evolution of homeopathy. When you say Hahnemann came up with a homeopathic principle and fixed method of understanding the patient. So Bonninghausen was the first person to came with a new concept of evolution and understanding of the patient, evolution of the symptomatology. So after Bonninghausen, Kent came. So everywhere there is an evolution from the basic fundamentals. So everything is keep on serving homeopathy to make it better. So it is very essential for us to learn both this fundamental and the contemporary method in a stronger, clear, and deeper way to make us grounded and more advanced in our clinical practice.
What would be your primary topic and what you will be covering in this course?
Yeah. So my part in this course is to having a session of miasm. So the miasm is one of the most misunderstood and most neglected part of homeopathic practice, even during the Hahnemann period and even in this modern times also. So when it comes to miasm, there are many ideas in the new homeopaths or the younger homeopaths with the number of miasms, which is 3 in Hahnemannian period and which has been extended to more than 3 numbers in these contemporary methods. So as I said earlier, so even this miasm is also nothing but an deeper and advanced understanding of the concepts of Hahnemannian period to till now. So these three and the extended miasms are not something new. So they are just an intermediate miasm. So this is how we are going to understand the miasm in this upcoming session. So what is the connection between this traditional miasm and the contemporary miasms? You see, in contemporary miasms, we have ringworm miasm, malarial miasm, typhoid miasm, cancer miasm, leprosy miasm. So, what are all these things mean? How we can apply, how we can understand the connection between all these things and how we can apply them in practice, how we can use them in analyzing a case, how we can use this in understanding the behavioral pattern of the patient. So, how this miasm is helpful in differentiating the remedy, in choosing the remedy, in individualizing the patient. So, all these ideas of miasms will be discussed in this upcoming topic. So, in this session, I will just try to give a simple outline of understanding the miasm in both traditional and contemporary methods and how we can apply them in practice. So, it will be a practical learning how to understand and apply the miasmatic concept in homeopathy in our clinical practice.